Okay, so now I want to talk about body movements, and these body movements will correlate directly to the muscle actions in your lab manual. You just have to understand what the words mean before you can attach them metaphorically to a specific muscle. So this is still in chapter 9. Remember, chapter 9 was mostly joints, but this is wiggling the joints around. So this is really the connection between the skeletal system and the muscular system. So I want to talk about body movements first. What I want to talk about is primarily what we call angular movements. These movements are generally at synovial joints, and remember, synovial joints are the wiggliest joints that are primarily associated with the limbs. Okay, so we're going to look at the wiggliest types of actions that you have. And what's going to occur with these angular movements is you start from anatomical position, which means you have to know anatomical position, and then you change the angle between two bones. So if you were looking at me right now and I said, okay, in anatomical position, and let's look at my skeleton instead because you can see him better. So in anatomical position, what is the angle between the humerus and the forearm bones? Well, it's about 180, right? So if I do this from anatomical position, I've changed the angle, right? Likewise, you have an angle between like the torso and the humerus, and I can change the angle there, right? Okay. I can change the angle between the ossa coxae and the femur. I can do it that way, or I can do it that way. Okay, I can even do it this way. So these are what are called angular movements. And the type of angular movement has a specific name. So when you're at the gym and you're working out, you call everything flexing, but that's not what it means anatomically. So what we have to do is, as always, we have to use the words very specifically. So when we are talking about this first set of angular movements, which is flexion and extension, they go together as a pair, and I'll show you some animations in just a second. Flexion says I start out with an angle at anatomical position. So my angle between my neck and my torso is 180-ish, right? I'm not talking about my chin, I'm talking about my neck. Or my angle between at anatomical position, my arm and my forearm is 180-ish, right? So when you are doing what is called flexion, you are decreasing the joint angle. So what the biceps brachii is doing here is starting from anatomical position and decreasing the joint angle. So it's flexion, okay? So it generally is an action that will bring two bones closer to one another. Okay, so let's look at a couple of different examples of flexion, and then I want to start to put this together with the whole origin and insertion idea, because these terms are completely related to one another. Okay, so let's look at this animation, and then I'll annotate on top of it when it's over. When you look at the animation, I want you to see if you can figure out where in the animation the origin is, meaning the relatively immovable point of attachment, and where the insertion is, which is the movable point of attachment that upon contraction is going to move closer to the origin. So watch the first video and try to figure out where the origin and the insertion are. They'll take his skin off in just a second. Okay. So upon contraction, let's look and see what happened here. Which one, top or bottom, proximal or distal, was the relatively immovable points of attachment? By the way, on the skeleton, the origins are almost always colored in red. It's kind of consistent. So the origin was up here, right? And upon contraction, this guy moved closer, right? And so the action was to bring the insertion closer to the origin. Good? Okay, I'm going to ask the same question on a different muscle now. This one confuses the heck out of people, so I want you to stare at it for a minute and try to figure out, when I do this movement, which is flexion, it's bringing these two closer together, decreasing the joint angle that I'll go ahead and tell you starts out at around 180. Which one's the origin and which one's the insertion when I am doing flexion of the abdomen or flexion of the vertebral column here? Okay, so which one's the origin, which one's the insertion? Contract, Okay, so which one moved? Which one moved far more than the other one when you did this? So the origin, people always want to make it up there on the sternum and the ribs, but with this one, for instance, when you're doing a crunch or a sit-up, you're holding the os coxae, the hip bones, relatively stationary, and then you're pulling that part of the muscle towards you. So the action is that direction, right? Okay, so these are both flexion. They are, upon contraction, you reduce the joint angle. So these are both flexion. This would be flexion of the vertebral column, and the other one would be flexion of the forearm at the elbow. And that's one of the things that you guys will be studying. So now let's think about this for just a second and go back to your notes for a minute and say, okay, so flexion is decreasing a joint angle, and it generally brings two bones closer to one another. And with these examples that you've seen, generally flexion is going to move something anteriorly, because right here I'm flexing at the elbow, here I'm flexing at the shoulder, here I'm doing neck flexion, here I'm doing flexion of the vertebral column or the abdomen. Okay, you can't see it, but I could do flexion at the hip. So generally with this pattern, you're going to find muscles responsible for flexion on what surface of the joint. So these are all anterior movements. So you're generally going to find muscles responsible for flexion on the anterior surface of the joint. But there's a big exception, and that is that the knee, the thigh, and then the bones of the leg, those don't move anteriorly. But when I actually bend my knee, I am reducing the joint angle from 180 to 90 or whatever. So the knee is kind of the exception to the rule in a lot of ways. And that's in part because we are evolved from quadrupeds, and so our knees work a little differently than you would imagine they do. Okay, so what's the partner of flexion? Since I told you that bones, that in order to do two different actions, you're going to have to arrange two different muscles on the two sides of the joint. So the flexion's partner is extension. So if this is flexion, okay, then putting it back. So flexion was bringing it up and reducing the joint angle, and extension is putting it back. So I can do what he's doing as well to show you guys. Okay, so this is flexion at the neck, and this is extension. So it's increasing the joint angle, but what it usually is replacing something back to anatomical position. So this is flexion at the shoulder, and this is extension at the shoulder, okay? So it's an increase in joint angle. It tends to be a straightening action. Some joints, not all, can do hyperextension. So if you go past anatomical position, flexion, extension, hyperextension. I can't do that at my elbow, but I can do it at some joints. When you go beyond anatomical position, when you're extending beyond anatomical position. So let's look at a video that shows us extension. Okay, so again, what we are looking at with this one is trying to figure out whether it makes sense that it's extension, because is it replacing something to anatomical position, right? Going from a lesser joint angle to a greater joint angle, and usually replacing it to anatomical position. And then the other question you want to be asking yourself is, can you figure out where approximately the origins are relative to the insertions? So let's look at that one. Where are your origins? So the origins, the ones that are staying relatively stationary, start all the way down here. There's actually more than one. And then the insertions are closer up here, right? Because it's pulling the insertions closer to the origins. So that is extension. This muscle right here that we are seeing is the antagonist to this muscle that we saw right there. So this one, of course, made you do crunches, and this one this one right here brought you back up from doing crunches. Okay. So what do you think? Since we said that this is usually the partner of a muscle that does flexion, what do you think? Generally, you are going to find a muscle that's responsible for extension on the what surface of the joint? If you found a muscle responsible for flexion on the anterior surface of the joint, then you're going to find a muscle responsible for extension on the posterior surface of the joint. Good. And this one was anterior. Okay. Now there are exceptions. Again, just like the knee was the exception in flexion because it doesn't flex anteriorly, the knee will also be the exception and extension. Okay. And then, so that's just flexion and extension. I want to do one more pair and then just talk about circumduction, and then we'll end this video and do the rest of them in the next one. Okay, so let's talk now about changing the angle in a different way. If you imagined again that the body had a midline, if the body had a midline, if you are moving things further away from that midline, taking it away, the word for that is abduction, as in kidnap, as in to take away. So here's a good example of abduction. Look at my shoulders. Abduct, to take away. I'm not moving anteriorly or posteriorly. Abduct, okay? And then if I want to do adduction, I'm going to move it back toward the midline. And again, the midline would be here-ish, right? So abduction and adduction, okay? So let's look at a video of abduction. Sometimes people say abduction, so you can hear the difference. So I want you to look at this video and do the same thing. See if you can figure out that it is abduction, and then also figure out which points are the origins and which points are the insertions. Okay, so what do you think on this picture right here? Where is the origin? Is it here or here? So the point that stays relatively immobile upon contraction is the origins. It's actually the clavicle and the scapula. And then the point that moves upon contraction is here, which is, this is the deltoid muscle. So don't be surprised later on when you find out that its insertion is the deltoid tuberosity of the humerus. Okay, so let us now visit what that means about where muscles should be, the logic of the muscles. So if a muscle is doing this and its origin is here and its insertion is there, generally speaking, when muscles allow something to pull it out, muscles that do that are going to generally be on the what surface of the joint? Yeah, they are going to be on the lateral surface of the joint. And a muscle that moves it back in, and I don't have an animation for you, but there's one in the video that I posted for you. And a muscle that moves it back in, that does this, it's going to pull from the medial surface of the joint. Okay, it doesn't always have to be exactly on the medial surface of the joint, but it's going to pull from the medial surface of the joint. So a muscle that adds it back, you abduct as in to kidnap away, and you add back. A muscle that does that is usually associated with the medial surface of the joint. And then one last little tidbit, and that is this complex movement called circumduction has to do with these four movements. So circumduction is when you take, I'll use my skeleton here, you take a joint that can do this and you kind of make a cone in space with it, okay? So it's, if I start from anatomical position, stay still, dude, and I go out, anterior, posterior, back. So I'm making a cone in space. That's called circumduction. And what circumduction really is those four movements put together in series, in which I do flexion, I do abduction, I do extension going back, and then adduction. Flexion, abduction, extension, abduction. That's circumduction. That's making a cone in space. Okay, so we will stop there and I'll do the other movements in the next video.